What is the most important deficit in the treatment of gout?
I think that the deficit is the schism between the primary care approach to gout treatment and that of the specialty rheumatology treatment of gout. And this is a very difficult divide to cross. I think we have enough information right now, but there's a lot of hard set attitudes, mindsets, because probably what happens is the primary care givers see gout only in the acute phase, and rheumatologists see gout in more of a chronic disease state, and we see gout that's more advanced and it's been more refractory to treatment. And until we can breach that divide, there's going to be a lot of people that are undertreated. And I think the second contributory reason is that the patients also have the sense that gout can be more of a nuisance than a chronic disease that can be incapacitating if undertreated. So there's still a lot of work to do in terms of resolving these particular problems.
I think our biggest deficit is a combination. One is that patients tend to not follow their regimen. They get started on a medication to lower their uric acid and they don't stay with it. And compared with that as well is that primary care doctors need to be more motivated, more engaged, get their patients below 6. And I think that's the way we're going to get patients essentially, quotes, cured, not cured in the sense that these patients need to stay on medication, but their ability to have full lives and get rid of their symptoms will be dramatically affected if they get prescribed these medications and they're able to stay on them.
Well, there's a lot of deficits to the treatment of gout. Understanding and having that personalized approach to each patient, I think, is a huge deficit. Understanding what patients will respond to what dose of medication, what patients won't respond, what patients will actually develop gout in the future and develop significantly tophaceous gout and debilitating gout would be nice to know ahead of time, and that way you could treat those patients more aggressively.
Well, clearly there are several. I think right now the most important deficit is the fact that we have a great deal of trouble getting to the point of good gout treatment even as we recognize it today. So the drugs that we have are not bad. They will work for many people. But what we find is that both physicians and patients tend not to use them. And when they're being used, they tend not to comply with them over the long haul. It's really about education. It's really about teaching patients and to some extent their doctors that gout is not an occasional problem, but a lifelong metabolic condition. It can be managed, but it has to be paid attention to. It's a lot like hypertension or hyperlipidemia. Patients understand that those are problems even when they're not feeling them. With gout, they don't understand that they have a condition even when it's not actively bothering them.